Hey, my name is Makayla Leviner, and I'll be talking about preeclampsia. The reason I chose this topic is because I have a 3-year-old. When I was 38 weeks pregnant, I was diagnosed with preeclampsia, which affected the little bit of time I had left with my pregnancy. Preeclampsia is a pregnancy complication. It is characterized by high blood pressure. It can damage your organs if not taken care of, or if it's not noticed soon enough. It usually begins around 20 weeks is when they start to really diagnose people with preeclampsia. Really the biggest sign for preeclampsia is high blood pressure. Usually preeclampsia is going to lead to a C-section, and it's most of the time why people end up having to have a C-section is because of high blood pressure and preeclampsia. Some people can go their whole pregnancy and not know, and then they get up to time to deliver and their blood pressure is out the roof, which then will cause the baby's heart rate to drop or other complications. A few signs and symptoms that you can look for if you are pregnant or wondering, do I have preeclampsia? You could, if you take a urine test every time you go to the doctor and your urine protein levels are really high. If you have changes in your vision, such as blurred vision, getting headaches when you're reading or stuff like that, you can have upper abdominal pain, nausea and vomiting, decreased urine output, shortness of breath, and of course high blood pressure. They say most of the time the high blood pressure is slowly, like that's why they don't start to diagnose you until after the 20-week mark, because then it becomes more reoccurring. A couple causes of preeclampsia is insufficient blood flow to the organs and to the uterus, damage to blood vessels, and a problem with the immune system. And then one of the big ones is genetic. My cousin was diagnosed with preeclampsia when she had her baby, but I didn't really take much into it. And after looking into it, just about everybody in my family that's had a baby ended up with preeclampsia. With the blood vessels, I didn't realize when I was pregnant that I had issues with my blood vessels. But after I had my son, looking at my legs, I have varicose veins, which are damage to your blood vessels. Parts of the body that can be affected by preeclampsia if not taken care of or controlled can include damage to the mother's organs, such as the heart, the liver, and the kidneys. It can also cause a stroke with your blood pressure being so high and left untreated for a long period of time. For you to be diagnosed with preeclampsia, you must have high blood pressure. It must be a reoccurring thing at your checkups. It can't just be, oh, you go in one time and your blood pressure is high. No, it has to be a reoccurring thing every time you go for a routine checkup. Protein in the urine, impaired liver function, onset headaches, like new headaches, like now I'm having just horrible headaches. My blood pressure's high. And it's usually, like I said, it's usually after the 20-week mark that all these symptoms usually start occurring and you start noticing them more. They can do a blood test to confirm that you have preeclampsia, or if you have any signs of complications in your blood, a urinalysis, which is usually done routinely at your pregnancy checkups. A fetal ultrasound can tell if anything is going on with the baby that is not supposed to be going on, or if the baby's having complications with blood flow or anything like that. And a non-stress test is going to show if the baby's stressed, because if the baby's stressed, then obviously there's something going on with the mother or the contact between the two. A couple things that you can do to prevent preeclampsia, which I did none of these. I probably did all of these. Little or no added salt. Drink at least 6 to 8 glasses of water, which I know was not my friend when I was pregnant. I drink a lot of soda. Rest. Rest is really big. Elevate your feet. Avoid drinking caffeine. And get regular exercise. You don't have to go above and beyond, but just everyday regular exercise. Treatment options. You can get medications that will lower your blood pressure. I know whenever I got diagnosed at 38 weeks, they gave me labetalog, which is a blood pressure medication to lower your blood pressure. steroids to improve platelets, and also it can help prolong your pregnancy so that the baby can stay in for as long as possible. Bed rest. I know a lot of people don't like to go on bed rest, but sometimes that's what's best. Staying off your feet and just resting, because your blood pressure gets so high, and then that can cause you to have to go to the hospital to deliver, and usually it's by C-section, which nobody wants. Delivery, that's the option if your blood pressure gets too high. Like I said, usually they'll have you go to the hospital, you'll be hospitalized, and if that blood pressure, they can't get the blood pressure to regulate, you will end up having usually emergency C-section. Because not only is it a threat to you, it's a threat to the baby. A little bit of history on preeclampsia. It tends to be the leading cause of maternal death, but mom or baby. It usually affects 10% of all pregnancies. It's a hypertensive multi-symptom disorder. It still doesn't have a treatment that's specifically for this. They give you things to be able to manage the symptoms of preeclampsia and to lower your blood pressure, but there has been no real treatment option for just preeclampsia itself. They give you things to manage the preeclampsia. So in conclusion, anybody can get preeclampsia. It usually will occur after the 20-week mark is when you'll start to notice it. Like I said, I didn't know until I was 38 weeks pregnant, and I had to get induced because my blood pressure was so high. My entire pregnancy had to stay on one side because they were trying to regulate my blood pressure, so I didn't have to have a C-section. So I was on my side for almost 13 hours. They gave me medicine to lower my blood pressure. They did things to help my blood pressure stay at a certain rate so that the baby's heart rate didn't drop or get too high. But then when I started pushing, my blood pressure went out the roof, and his heart rate bottomed out. So I ended up having to have a C-section. And C-section tends to be what just happens to women who have preeclampsia. Some do get lucky and they can deliver natural. But in conclusion, preeclampsia is mainly involved with high blood pressure. There really is no treatment options. They can manage your symptoms of preeclampsia. But there are tests that can be done to determine whether you have it or you don't. Sometimes it tends to go overlooked pretty easily. I'm not sure why or how, but there are medications, bed rest, some preventions. Of course, there's always preventions. No caffeine, drinking water, making sure you're hydrated, exercise, rest, no salt, because salt, of course, raises your blood pressure. But you want to make sure that if you do have preeclampsia or you're experiencing symptoms of it, you get it taken care of, because it can cause damage to the mother's organs and to the baby. The sources that I used were mayoclinic.org, American Pregnancy Association, and ncbi.mlm.nih.gov, and I have these right here. So I hope you enjoyed my presentation, and maybe I gave you a little bit of insight on preeclampsia. Thank you for watching.